This conference will now be recorded.
Good morning, everyone. Welcome to Whatcom County Health Department's media briefing for Tuesday, August 25th, 2020. I'm Melissa Morin, Public Information Officer with the Whatcom County Health Department. Today, we'll hear from several Health Department speakers, including Erica Lattenbach, Whatcom County Health Department Director, Mark Reka, our COVID Response Coordinator and our Case and Contact Investigation Lead, Cindy Hollinsworth, Communicable Disease and Epidemiology Manager, Kim Hankinson, Public Health Nurse and lead of our Education Response Team, and Tom Kunish, Environmental Health Supervisor and lead of our Business Response Team. As a reminder, this meeting is being recorded and will be available later today on the Whatcom County Government's YouTube channel and on our media page at www.whatcomcounty.us/COVID. Today, we're going to be asking members of the media to type any questions for our speakers into the chat feature, along with your name and affiliation. The chat feature is currently open, so please feel free to type in your questions directly to me at any point during our speakers' presentations. We will be holding all questions until we've heard from all of our speakers, and we'll take those questions in the order presented in the chat box. And with that, I'm going to pass things off to our first speaker, Erica Lattenbach.
Good morning, everyone. Thanks for joining us. I wanted to make sure that you all had an opportunity as we are taking a breath with reduced case rates these last couple of weeks, that you had an opportunity to hear from some of the staff that are on the ground doing the work. I've been able to provide you with high-level summaries of the work that we're doing, but this is an opportunity to hear from those that are in this every day and have a lot of the specifics and details about the work that they're doing. I do want to start off by sharing a little bit of what we know about our reduced case rates. As you've probably seen, our case rate peaked several weeks ago at 90 cases per 100,000, and we are now at 33 cases per 100,000. And we've been trying to understand what the drivers of that are, knowing that there's a lot of complexity in this work and in the process and in the disease. We do know that in the past 6 weeks, almost half of the people that we interviewed in our new case investigations had interacted and had known that they had interacted with people who had ended up testing positive. So that may be a friend, a colleague, a family member, a household member, but they did have a known contact to someone that we had identified as a case. What that suggests to us is we do have a fair amount of knowledge about the disease spread. However, it also suggests that about half of the people that are testing positive were either interacting with someone that they didn't know had COVID or who didn't themselves know, who were potentially asymptomatic. So we are continuing to look at our data and drill down on more information about the spread of this disease, the reduced case counts, and trying to better understand where we sit and what to expect. It's as I always say, the only thing certain about this process since February is the uncertainty, and we continue to try to analyze the data and understand more so we can continue to have a handle on this disease. So with that said, I want to talk, and some of you have heard this, but I want to talk about a little bit about the process from start to finish. And the start of the process in the health department's involvement is really events like this. So public education and communication about risk, exposure, what we're seeing, what we know from the data. And that includes to residents, to media, and elected officials. And it also includes our guidance and best recommendations to the public. We do this in partnership with Whatcom Unified Command through their Joint Information Center. So this is a really key and important part of our work as a health department and in our response. And it also comes into play with our specialized teams, of which some of them are represented today and can talk a bit more about how they, in this stage of the process, the public education and communication, are working with businesses, organizations, schools, etc. The second step is the testing process. And unfortunately, but not surprisingly, our testing team is not available this morning because they are actually at the testing site doing testing. But I'm happy to answer follow-up questions you may have about the testing and what we're seeing so far. Testing is, as we say in public health, necessary but not sufficient. We have found that testing, while important as a link, is only one link in this process. So once we have a test and we see that there's a positive case, we then make contact with them, and we have our case and contact investigation, one of our leads here represented to talk about that process. And that is an important step, as we know, because it helps us better understand the spread of disease. And it also paves the way for the final step in the process, which is effective and successful isolation and safe isolation or quarantine. So this process really moves from public education and outreach all the way to that last day of isolation and quarantine when our public health nurses provide discharge papers and a consult with an individual. And we do have a team, our isolation and quarantine team is here as well to talk about that process. And that is also in partnership with Whatcom Unified Command that runs the Byron Street Isolation and Quarantine Facility. So there's great level of coordination and communication with Whatcom Unified. Whatcom Unified is also critically involved in our testing process. They are providing the logistics, the support, supplies, volunteers, etc. in this process. So these all of these functions and all of these steps along that process involve the health department, but also our trusted partners like Whatcom Unified Command. So with that, I want to turn it over to Mark Reka, who will be able to talk to us about the case and contact investigation process and that team. Thank you, Mark.
Thank you, Erica. So thank you all for joining us today. And I just want to talk briefly and give an overview of what the case and contact investigation teams are doing. So as Erica mentioned, our case and contact investigation or contact tracing is essentially about limiting the further spread of COVID-19 in our community. And to do that, we have a small cadre of staff and volunteers working 7 days a week, made up of 12 staff, a mixture of 17 part-time and full-time volunteers. And we have another 6 individuals in the process of being hired and trained as we speak. And on any given day, we receive notification about newly confirmed cases. We immediately begin the process of contacting those individuals. And our goal is to be able to get a hold of them within 24 hours of us getting their lab results. In the last month, we've been able to do that with about 92% of our cases. And we really want to see that number stay at or above 90%. And fortunately, like I just mentioned, we've been able to do that since we started tracking the timeliness of our case investigations back in June. You may have heard reports that some people don't want to answer the calls from the health department. And we've had a couple of those experiences too, but we do find that the majority of people eventually do answer or return our phone calls. As I mentioned, and sometimes it does take us more than 24 hours, and it takes repeated attempts sometimes to make contact with cases. And while that doesn't track successfully in terms of our 24-hour contact time metric, it's very often still a successful investigation from the perspective of contact tracing itself. For example, if it takes us 36 hours to reach all of their close contacts, even if we didn't get a hold of them in the first 24 hours, it's still successful in being able to notify people who we've learned and now know were exposed to COVID-19, so that those individuals can begin to take the necessary precautions themselves. We aim to talk to all of the confirmed cases, close contacts within the first 48 hours of their lab results. And as we brought on more case contact investigators or contact tracers, we've been able to do that. We've been able to meet that goal about 80% of contacts in the past month. As you can probably imagine, this workload varies by the number of confirmed cases and then close contacts each case has. And on average, we're seeing about 3 to 8 contacts for each new case. Also want to emphasize that the job of our case contact investigators is simply to notify individuals who could be at risk of COVID-19. The case and contact tracers don't at all judge or shame anyone for their social activities. And in fact, I know the staff is very grateful because the majority of people are very honest and candid and forthcoming about who they have been in contact with, which helps us continue that process of notifying others. Most people recognize that this actually is important information to help them, their friends and families, to protect everyone's health. And contact tracing, again, is obviously easier, and disease transmission is there by far less when people are limiting their social contacts and not gathering in large groups. So it's just a good reminder again of why we urge people still to limit their close contacts outside the house to no more than 5 people per week. And with that, I'm now going to turn it over to Cindy Hollingsworth, our Communicable Disease and Epidemiology Manager.
Cindy, this is Melissa. I think you're on mute. We'll have you go ahead.
I could only remember to turn on the camera. All right, thanks.
Thank you.
Hi, everyone. Cindy Hollingsworth, and I'm here to speak to you about our quarantine, isolation, and recovery team. So this is a team that provides a lot of information and support. We do general information for the regular public on isolation and quarantine through our nurse consult phone line, and that's just people who call the health department for information and get referred to us. I just wanted to give you a little reminder that isolation is a minimum of 10 days for those who have a positive COVID test, and a 14-day quarantine is a voluntary strategy that we ask those exposed to someone with COVID to do to help control the spread of COVID-19 in our community. So this is a team of public health nurses and community health workers who monitor people in isolation and quarantine. And generally, we have 3 nurses and 1 community health worker on shift 7 days a week to complete this work and support the community. We provide specific individualized directions for those who are on quarantine or isolation with daily support check-ins, and those could be by a phone call or by a text message, whatever the individual chooses and works best for them. We have an automated system that people respond to with the text messages. So we monitor that system to identify people in quarantine who've developed symptoms or who are not reporting. When someone in quarantine begins to have even mild symptoms of COVID-19, we work with them to get them tested quickly. And other things we do specifically are to reach out to individuals on their last day of isolation or quarantine to verify they meet the criteria for release and provide a release letter if they need that. We also work with people to extend their isolation if they need to, are not feeling well and are still symptomatic, and that needs to be extended. One of the big things that we do is to follow up with individuals or households identified who may need additional health or social services support to successfully maintain their isolation or quarantine. And this can include referrals to services and resources for food, rental, and utility assistance. Each one of us will need different or very individualized support to maintain isolation or quarantine. And so that's what our team works to do. Our work could also include facilitating a stay at the county-supported isolation and quarantine facility on Byron Avenue, when this is where individuals can safely isolate or quarantine, which helps decrease the spread of COVID in Whatcom County. Our role with people staying at the isolation and quarantine facility is the same as monitoring those in their own homes, and that includes monitoring for discharge dates and helping determine those. And then in addition, our staff also attends a daily meeting with the staff on site at the isolation and quarantine facility. So that's kind of a quick overview of the work that our team does to support individuals in our county to maintain isolation and quarantine. And with that, I'll introduce you to our next speaker, and that's Kim Hankinson, a public health nurse working on our education response team.
Thank you, Cindy. Our schools and childcare providers do the vital and challenging work of caring for, educating, inspiring, and training our next generation of leaders. We know how essential they are, not just to the children and families they serve, but to our whole community. And we want to support them in doing this work safely. So that's why we have dedicated 2 staff, a public health nurse and an environmental health specialist for our education response work. Our team is tasked with providing current information and education on COVID-19 to schools, childcares, and other youth programs, keeping them up to date on changes in the guidance, providing technical assistance on implementing that guidance, and collaborating on the creation of supporting materials, resources, and protocols. And then working closely to manage the response should they get a confirmed case. A recent report from the Institute of Disease Modeling indicates that reopening schools to in-person learning poses significant risks to staff and students, and estimates that between 5 and 42% of Washington schools could have at least 1 person arrive at school with an active COVID-19 infection. So it's crucial that schools take all the precautions possible to prevent COVID-19 transmission in their buildings and take a careful and cautious approach to reopening. Understanding the guidance from our state and federal public health agencies and interpreting it into practice is no small task. Being available to provide this support and technical assistance to schools and childcares has been much appreciated. Schools have many questions on things like daily health screening and attestations, protocols for what to do when someone becomes ill at school, face coverings and PPE, physical distancing and movement through the school, buses, cleaning, disinfection and ventilation, and then putting it all together as they bring in staff, high-need learners, and some families and students for in-person assessments or conferences in this initial stage of opening. To give you an overview of what we've been doing so far to support public, tribal, and private schools in the county, we've been joining in monthly child care director meetings hosted by Child Care Aware of Northwest Washington. We've been participating in school reopening planning meetings and task force as requested. We've been providing ongoing one-on-one technical assistance to individual child care, schools, and districts. We've been participating in a regional collaboration with other local health jurisdictions and to review guidance, share our knowledge and resources, and then bring questions and recommendations up the chain to get solutions. We've been collaborating also with a county-wide schools group to share, again, information, resources, materials, and problem solve. Bellingham Schools has taken the lead on this work with the motto of working stronger together. Our team is present to answer questions and provide technical assistance at those meetings as schools create procedures for implementing the guidance to prevent COVID-19 infection at their school. Additionally, we are working with the school nurse corps administrator to reconvene our school nurses county-wide for periodic meetings in this school year. The other important aspect of our education response team work is to prepare schools for when and if they have a confirmed case of COVID-19 among staff or students. We've been working with schools to guide them in planning for how they will manage cases, and we are developing tools to aid them in this work. This plan includes clear lines of communication between the school and our team, contact tracing. Schools have to be prepared to help with this. Schools do have some experience with contact tracing in relation to other infectious diseases like mumps or chickenpox. When we do contact tracing with adults, we're able to interview them and get information about where they've been and who they've been around. But with children, we have to rely on the adults who supervising them to give us that information. So that means we'll need to work with schools to identify who could have been exposed to the person diagnosed with COVID-19. Being prepared now with plans for contact tracing means that schools can quickly and efficiently act if they need to respond to a confirmed case. Implementing strategies such as assigned seating and cohorting will facilitate contact tracing. That's some of the things we work with them on. Cohorting also will help limit transmission into the community. This planning work also involves working with us to notify the close contacts and continuing to monitor for absences and illnesses, and working closely with our team to watch for any transmission within the school that could lead to an outbreak situation. We also working with them on assessing their safety plans, how people are doing adhering to those plans, evaluating for exposure and transmission risk, how the guidance is being implemented, and then making any recommendations and any needed changes. With so much for the schools to consider about how to provide education safely, reopening schools slowly is smart. This gives the schools a chance to test out their procedures that they worked so hard to plan and see what works or what needs improvement. And there's still a lot we don't know about this virus. There's some evidence that shows that younger children don't play as much of a role in transmission of COVID-19 as older children and adults, but we don't want to make any faulty assumptions as we bring students into in-person learning. We also don't know what to expect this fall as the weather cools and we move indoors, we head into cold and flu season. We don't know what we're in for. So I also want to say, get your flu shot. I'll end by saying that I have been really impressed with the creative and hard work that all the schools have been doing to prepare for reopening, and also our childcares as well. I mean, they are the essential worker heroes in this pandemic. And I'm honored to be a part of this team and looking forward to continuing to partner with schools and childcares on the other side of COVID-19. So with that, I'll turn it over to Tom Kunish to talk about our business response team.
Good morning, everyone. Thank you for the opportunity to speak today. As Kim indicated, I lead the Whatcom County Health Department Business Response Team. That's a team that was developed after the need was identified to work with businesses whose employees are affected by COVID. So that might mean an employee who is diagnosed with COVID, or somebody who is exposed to a person diagnosed with COVID. Business operators, when these situations come up, have lots of questions. There are things that need to be done to protect other employees and the general public from further transmission, and we help guide them through that process. Thus far, we've worked with over 200 businesses who have experienced some kind of exposure and required some assistance and response. We assist business owners with identifying people who are close contacts of cases, of confirmed people who are diagnosed with COVID. We assist in tracing those contacts in the workplace, helping with advice about isolation and quarantine for people that are exposed to COVID-19. We also help businesses by reviewing their operational plans and their prevention plans. Oftentimes there are many questions. There are different templates for plans, and after speaking with many businesses, we have a really great impression of what the best practices are and can advise about what the best fit might be for an individual business based on the type of work that they do. We will take those plans and then try to bring them back to the real world by doing virtual tours of businesses and identifying potential exposure risks and work on prevention ahead of time as much as possible. Our experience working with businesses has indicated some things, and most of those things are encouraging. Most people diagnosed with COVID-19 and are employed in the businesses that we work with, we find most of the time they're exposed outside of the workplace. Most employers have already developed effective COVID-19 prevention plans. And this is kind of borne out by the fact that in a lot of cases, our investigation with employers don't reveal any close contacts at work, which means that they've already done the hard work of prevention before a person diagnosed with COVID crosses their doorstep. The the workplace prevention measures have helped make workplace exposures rare. Some of those measures include daily screening of employees for symptoms of COVID, excluding workers who are symptomatic, mandating distancing between employees at work and between employees and patrons, mandating mask use. Other measures include something that Kim mentioned, cohorting. So taking large staffs and breaking them into smaller work groups that interact regularly, but don't interact as much with other work groups, at least not in close proximity, so we can prevent spread if one of those people ends up being diagnosed with COVID. So in short, we are the support group for businesses in Whatcom County. We have a team of 4 individuals that help businesses navigate the process of managing exposure to COVID in the workplace. And it's been our privilege to do so. It's been a great opportunity for us to help with the community. And we appreciate the cooperation and assistance that the businesses have provided in our collective efforts to prevent COVID spread in our community. With that, I will turn it back over to Melissa Morin to take us to the next portion of the talk.
Great, thanks to all of our speakers. As a reminder, we're inviting members of the media to go ahead and type any questions you have for our speakers into the chat feature, and we will continue to take those questions as they come in. Our first question is from Julie Shirley with the Bellingham Herald. Julie's asking, is there still a quarantine facility at the Holiday Inn? Can you update occupancy numbers for both facilities? And Cindy or Erica, it looks like this question may be for one of you.
Yeah, I can take that one. We have the one county supported facility, and that's at old Motel 6 facility on Byron Avenue off of Samish Way. And so the daily occupancy rate has really varied there, anywhere from none, 1, 2, up, sometimes 12, 13 people. And then a couple of times we did have larger amounts than that. So, and I don't have details on overall occupancy at this minute.
Thanks, Cindy. Our next question is also from Julie with the Herald. Julie's asking, will school outbreaks be made public by the health department? And I'll go ahead and start with an answer to that one and invite Kim Hankinson to tag in on this as well. We, as always, when there's a situation occurring in any sort of facility or institution, we work directly with those facilities, or whether that's a business, long-term care facility, schools, to work together with them to determine how best to communicate with the public. And that's part of the planning that Kim has been mentioning that we are doing now with schools, to set plans in place for how to notify families, how to notify all, families who may have been close contacts of a case, families just within the whole school, and then out to the wider community. So we're in the process of developing some of those protocols right now. And Kim, I don't know if there's anything you'd like to add in response to that as well.
No, I think you covered it. We'd be working in collaboration with the schools on their communication plan. Yeah.
Our next question is from Key Relia with the Herald. Key's asking, what are your thoughts on private schools in Whatcom County, which say that they're following health and safety protocols, bringing students back for in-person classes in the fall? And Kim and Erica, it looks like this is a question for the two of you.
Well, I can start. This is Kim. So the Department of Health created a guidance and a decision tree to assist the superintendents and school leaders in making those decisions about reopening. And then our team is here to provide technical assistance, and we'll be working closely with them to help them to do this safely and follow the other Department of Health guidance, the K-12 guidance.
Thanks, Kim. Our next question is from Oliver Lazenby with the Northern Light. Oliver's asking, the county's low barrier testing schedule currently runs through August 30th. Will the mobile program continue after that? Erica, I think this is a great question for you.
Sure, I can answer that. Thanks for the question, Oliver. So each Saturday, the schedule for testing and the ability for folks to sign up for testing on Test Directly, that opens. So you can only schedule for this week, but the mobile program will continue. We are refining times and locations. So for example, on Monday, we had testing at our Champion Street parking lot and found that there were a few sort of traffic and safety related issues with that kind of volume. And on Saturday, we'll be moving that site to Civic Field that can more easily accommodate a larger volume of cars. So there will be some tweaks. We may move a testing site from the morning to the afternoon. But we are continuing this program. This is a long-term program, and so we will be continuing that.
Thanks, Erica. Our next question is from Kirelia with the Herald. Related to K through 12 schools coming back for in-person classes, is there a metric for when they should have to shut down if there are COVID-19 cases? And Kim and Erica, I think this is a question for you.
Yeah, I can start. Thanks for that question. So yeah, the K-12 guidance from the Department of Health does give guidance on looking at transmission and outbreak. And so if we are seeing transmission of cases, certainly if there's an outbreak, then that's a decision that Dr. Stern can make with that school on whether or not they would need to close. But schools do need to be prepared for if we start to see increase of cases in the community and transmission, and certainly if they get cases in their school, they need to be prepared for potentially scaling it back. And we certainly want to minimize any disruptions in learning for students. So, and let's see, what else would I say to that? Yeah, I guess I'll just, that was what I meant to say, thanks.
Thanks, Kim. Our next question is from Joe Tehan with KGMI. Joe's asking, the state COVID dashboard shows Whatcom County with an infection rate of 27.5 cases per 100,000 over the past 2 weeks. Is that accurate? And will that allow restrictions to be relaxed more? Eric, I think this is a question for you.
Yes, thanks, Joe. I'm looking at the risk assessment dashboard, and it looks like it's at 33.3 cases per 100,000. But at any rate, it's low, and it is close to that 25 per 100,000 threshold, which I'm sure is part of the reason why you're asking this question. I do have a call with the state later this week to talk about this very issue. We know that people want to get back to work, that businesses want to reopen, that there are lots of economic challenges in our current state of affairs, and that we do have a lower case burden than any other large or medium-sized county in the state. That said, this is really a statewide decision. As you know, the governor has had a moratorium on phase progression since I believe the middle of June. And until that is lifted, and until we as a state and as a county reach those thresholds and have confidence that we can maintain that level, I don't see this changing at the moment, but we are in conversations with the state about this. I think there are also concerns about about school opening in the next couple of weeks and what impact that might have on our case rate. So so it's an ongoing $1 million question that you ask, and I do not and I'm not in a position to be able to answer that decisively because that's really a state decision.
Thank you, Erica. We'll do one last call for any additional questions. And I'll just offer thanks to all of our speakers and thanks to all of those who attended, and remind everyone that this briefing will again be available later today on Whatcom County Government's YouTube channel and on our media page from our COVID site. And with that, I believe we'll go ahead and end things for today. Thank you all, and we will talk with you soon.